Hi.
Hi.
Well, welcome, welcome to the Fringe. Our guest today is a very dear friend of mine, Dr. Perry Nickelston, and we have known each other, Perry, since 2011. So
Wow,
that
was that the year?
makes,
I was trying to figure that out. I'm doing the math in my head. Wow,
yeah,
that's
2000,
crazy.
2011, I reached out to you. You were an FMS instructor, I think, at the time.
Yeah, I was big into
And
FMS, still am. But yeah,
yes, yeah. And I had I'm not exactly sure where I saw you speaking or doing something, but I felt your energy and reached out to you and said, "Hey, you know, I knew that you had known about the company I was working for at the time called Rock Tape. I knew you had known one of my colleagues there, Dr. Steve Capobianco, and the rest is sort of history. You became one of our most beloved instructors at Rock Tape, and I think that really put you, on a path that you were already starting to sort of what I say machete. Like you don't pick paths, you go and make paths. It is very clear for anybody that knows you. So yeah, at the time, I think we loved talking about fascia and movement, and I think somewhere in those Rock Tape years, you really started diving into the lymphatic system. And
Yep.
interestingly, 15 years later, I feel like people now are just starting to say, oh, you got to look at the lymphatic system, which
Yeah, I'm like,
is,
welcome. It's nice to have you here. Yeah.
yeah, welcome to the path that I just macheted for 15 years. So, yeah, I was hoping you could share. Today, we're going to talk about lymphatics, the lymphatic
hmm
system. We'll talk about a lot of the stuff that you do to help people's lymphatic systems, and then, where light can sort of fit into
Oh,
that.
big time. Great.
Yeah,
Yes.
into that conversation. So when did you start really diving into the lymphatic system? Because I feel like it had a lot to do with you personally having some health struggles, and then probably, patients as well.
Yeah, before I get into my story, I will tell you, I was thinking about, first of all, my days with Rock Tape were some of the most fun I've
I
ever had
know,
in
I
my life.
know.
The crew was great, but you gave me a real opportunity to just travel the world and the U.S. and conferences and speak in front of a lot of people. And that helped improve me as like a doctor and as a speaker and as a communicator. And plus, I just love using the Rock Tape. And I went back at some of the early slides because I kept decks. We called them decks. People might
Yep,
know that.
yep,
And I didn't realize it at the time. It was just like right in front of me. But in our classes, we were talking about how tape can impact fluid dynamics,
yep,
edema, swelling, inflammation, and lymphatics. We would cut the tape in certain ways to help pull the fluids certain way. And I think Rock Tape was ahead of the game because they were talking, and Steve came up with all the educational content about fascia and fluid and neurosensory. I mean, he himself was way ahead of his time with
yep,
stuff. So I'm going to give
yep,
mad props to him.
yep.
But when I was teaching that, I'll be honest with you, I just kind of skipped that thinking,
Yeah.
well, let me
I,
get to how to tape a shoulder, how to tape a back, because those are helpful and they're great. But it was like, how did I miss this my whole career from when I was in school? And the universe has a way of bringing you to things to discover in its own unique way. And it's usually through hardship, suffering, and misery,
yeah,
unfortunately, right?
100%. Yep.
Because that motivates us to change. Because if you're comfortable, you're like, why am I going to do that? I'm like
Why would,
surfing pretty good here, right?
yep, yep,
And I honestly, I was in that musculoskeletal world, chiropractor since, I graduated in 1997, did a lot of myofascial work, trigger point work, movement work like crazy through the FMS and stuff like that. And, I was cruising, I was feeling good until I
yep,
wasn't feeling good. Like I started to get like the more immune system type reactions. I had like an autoimmune
yep,
disease
yep,
that slowly crept up on me, which is that's the way they work. They're really stealthy like that. And then people always ask me, like, which one did you have? And I said, you know what? I kind of felt like I had everything you could possibly list off
Yeah.
because I was in bad shape. And I was using all of the tools that I learned over my years in my career to try to help myself feel better. And unfortunately, it like wasn't working. I was not getting better. And I said, well, there's got to be something I'm missing here, man. So I had to go back, start using my clinical reasoning process, which was not easy to do because at that time my brain was fried with neuroinflammation and brain
Yep.
fog. Now everybody talks about neuroinflammation, and I had that a long time ago. And I said, what's missing? And then that's when I just went back to study physiology, biology, came across, I was looking at immune system stuff, and I saw the lymphatics. And then I'm like, what the hell is that? And then I started doing some lymphatic work, just investigating it. And then I was like, oh my goodness, I don't know if it's in my head or not, but I feel so much better within just a couple of sessions on that. And then I just kept up with it. And within 30 days of doing dedicated lymphatic work that I've since refined over the years to make it
Yep.
work even better, I was like 60% better in a month where I was suffering for about a year
Yep.
doing everything else. And I'm like, there it is. That's it. And then that was the sign, if you will, that
Yeah.
Perry, this is the direction you need to go in. You need to dedicate your life to this and also teach other people. And the greatest part is I was able to take everything else I'd learned up to that point from the myofascial work and the neuro work and then combine it with my approach to lymphatic work. So for instance, I've been using like laser therapy light for a long
A
time.
long time.
Like 20 some odd years. I was using those things when people were like, you're out of your freaking mind. What are you using that for? That doesn't do anything. Where's the research? And I'm like, you watch, you wait. And then I was using it for pain. But then when I learned about lymphatics, I said, I wonder what would happen if I shine this light on lymphatic lymph node clusters, like just knowing where they are,
Yep.
right? And then I really started to focus a lot on the places where a lot of the lymph was located, the neck,
Yep.
from the collarbone up. And then, holy smokes, I just started to see systemic full body changes like in everything. And then I began to go from the neck down into like the abdomen, like the belly. And I was doing laser at the time, and people started to reach out to me and said, how are you getting such great results? And I said, well, the stop chasing pain mantra at that point, and still is that look beyond the side of pain. So when people would come to see me for like a musculoskeletal injury, for instance, let's say like my knee hurts, you can really help that knee by putting the light on the knee. No joke, right? But then I started to put my laser light somewhere besides the knee, somewhere that didn't hurt. And then I would put it on the neck and the knee, the abdomen, neck, and knee. And then what I noticed is, holy smokes, the knee gets even better because it's the whole everything is interconnected thing. And people began to notice a huge response. And that actually tied back into my journey with Gray Cook and Lee Burton in the FMS world or SFMA world called the Selective Functional Movement Assessment. Their whole jam is telling you to look for dysfunction somewhere that's not painful. And then that will help your painful dysfunction. And that's all it was. But here's the gist. I was never looking at anything through a lymphatic lens prior to that point. I was always looking at it a musculoskeletal lens or even just a fascial lens.
Yep.
So now I never touch anywhere or do any fascial work unless I understand what happens to the fluid systems in where you're touching, around, and everywhere else. And then that will change everything,
Yeah.
like
I
significantly.
think what's really amazing is that you had the building blocks or sort of the philosophy or the spirit of approaching, someone's health became very systemic. So whether it was movement or fascia or the nervous system or whatever it may be, when you jumped into lymphatics, it was very obviously intuitive to you at that point to just put all of this together and say, listen, systemically, people are inflamed. Systemically, people are not moving right. All of this is so interconnected that I think obviously it must feel good at this point to feel like you've figured out so much. And then knowing how I know you, what I would love to end our talk today with is like, what is it that you want to go learn next? But let's talk more about
Okay.
um, light. So we get asked a lot about laser light all the time. Um, and it's funny because I think I started using laser light when you did, probably really truly 25 years ago in
Yeah.
clinic. And I would do the same thing. I would shine the laser on the area that was injured and I would get amazing results. And, I don't even know at the time that I could explain it even 5% of how I can explain it now. We
Right.
were just like, oh, this is going to reduce inflammation and heal the tissue, and we would zap it for a couple minutes. So for me, getting into the world of LED light, it, it really connected for me. And I still feel like people want to disconnect that conversation. So I talk to clinicians, they say, oh, but you're not using laser. And it's like, it's light, sun, LEDs, laser, whatever it may be, it's light and it energizes our system and it affects inflammation and fluid flow and pain reduction and helps with, it's healing. What
Yeah. I mean, I love all forms of light, honestly, right? I mean, light is life. And if they had they had the therapeutic light that you have now and that you see more places, one of the reasons you see that, first of all, is because it's working because people feel better and it's supply and demand. That's just straight up the way it is.
economics.
And then when you get into it, yeah, you realize also, oh, well, there's a lot of physics and chemistry behind this too. Which you've dedicated a lot of your time to researching and learning, that I would have added these to my arsenal 20 years ago in conjunction with the laser, to use. So one is that, so yeah, I can treat people when they're in my office with my $25,000 laser. But what are they going to do when they get out of there? Like, what are they going to do when they're home? That's when they need a lot of it because that's going to instill it in their daily life and their daily habits. And, you can absolutely start to move that healing needle with a session in your office. But then they say, Doc, well, what can I do at home? I'm like, you can't really do anything with the light except come back to see me. And my job is I don't want to see you. Like, I want to make sure that you're getting better and you can heal, recover, and regenerate so you can get back to living. And I think it's really interesting because you go back and you look at the stuff when we would try to explain to people how this heals, we always use the biohack buzzword that everybody talks about now, but it was always mitochondria. Like, that's what you would talk about all the way back then, which is just energy, basically. And then now you can't go anywhere without a hacker talking about tapping into your
Yeah,
mitochondria. And I'm like,
right.
yeah, like honestly, that's what you want to do. And then light's a really effective and feels awesome. I mean, I use it all the time. And, that's why I have your products and I recommend to everybody because the people that I end up seeing are, they're really in like a bad spot. They have a lot of issues going on, kind of like I had. And I always do stuff to the neck, to drain the lymphatics in the neck. And then revelation within the last several years, they're like, the neck's kind of a big deal to keep your brain clean.
Yeah.
And I'm like, yeah, I knew that 25 years ago. And so you wear the thing around here and you go at your collarbone for the lymphatic drain. And then the brain helmets are awesome because if you step into my office, I already know you have some type of brain inflammation. And
Yeah, for
then you
sure.
can, there you
Yep.
go. There you go. That awesome
Yep.
helmet to put on. And many people that I see, they have a lot of head trauma, post concussion syndrome, traumatic brain injury, or one of the biggest things is that they just have this daily human being, modern day posture sitting and slumping and this forward head carriage that just compromises everything from your collarbone up. You might as well just apply a tourniquet to all the blood flow in your whole body with how people just sit too long, or in a position that's not ideal for too long. Because listen, sitting is not a bad thing. It's not the enemy, just like inflammation. Like, you need to sit down and take a load off. If you can deep squat when you do it, I mean, thumbs up, that's even better. But, it's just how long are you doing it? Same with inflammation. Like, if you didn't have inflammation, you would die way quicker. It's just that, can you turn the inflammation signal off or get rid of the inflammation? And light's really, really, really good at that. But then that's when I realized, I was like, well, how does the inflammation what happens to the inflammation? Like, where does it go if you're trying to get rid of it? And I never thought about that. Like, I got to reduce inflammation. I'm like, well, what's the biggest system in the body that actually does that? Holy smokes, guess what it is? The lymphatic system, right? So I said, well, that's probably a really important thing to take a look at and see how the lymphatic system, this is the thing, works everywhere, not just where you have your swelling. And that's back to the systemic, full body, all systems work together, nothing gets separated. And then that's when it clicked. And this is, I knew I was on the right path, because how do I know that I'm on the right path? Because that's how physiology works. That's actually how physics work. Stuff has to move in the body. So movement is awesome.
Yep.
But like, what are you moving? Well, the biggest thing that you're moving inside that you're really never, you know what? You're actually right, Doc. I'm moving a lot of fluids around. Because you're like I always say you're like a big giant snow globe, shaking it up. And the snow in there is like your cells, but it's also your waste. And you got to have some way for waste to get out, because if you can't find a way for waste to get out, your cells are not going to like you very much, like at all. And then the way they're going to tell you that they're not happy is they're going to hurt you. They're going to give you some disease label that you'll get in a book. And then you're going to struggle and you can't get well and you don't know why you can't get out of the quicksand. And then I'm going to tell you, first start, begin to work with your lymphatics and your nervous system, stuff like that. And then and throw in some light, good stuff happens.
Yeah, I feel like when we started making all the LED light products, I should have seen it coming that we'd eventually just make one big mat that you would lay on every day and just bathe yourself in some extra light and move on, but we sort of interestingly arrived at the same outcome that you arrived at when looking at movement and fascia, which was like, we made a pad for the shoulder, we made a, wrap for the head, we made one for the knee, and we've made them for everywhere, as you know, neck, vaginas, I mean, you name it, we've made light for it. But at the end of the day, the system is head to toe, top to bottom, inside and out. And something that I think about, sort of back when I knew that you weren't feeling very well, is I could tell. I think you can tell when people don't feel well. So can you kind of speak a little to we know what people feel like when their lymphatic system is absolutely not working. We know they just feel tired and run down and they're in pain and they've been diagnosed with, you name it, autoimmune to cancer. But what do they look like?
That's a great question. Well, one, I'll say that I've been doing this a long time, and I think the lymphatic system is going to play a part in every symptom that you have, because it's the primary system to help your body recover from inflammation and remove stuff out of you, right? And if that's compromised, it's just a matter of time of when something might manifest. Okay? But some of the biggest things that I see, because honestly, when people look at, at least it used to be, because it's becoming more talked about, people would only think you had a lymphatic system issue or talked about it if you had an abnormally, really swollen body part, like a leg
Right.
uh, or both legs, because lymphedema, which is a condition where there's been damage to the valves of the lymph and they can't flow out, so they stay down below, and then stuff just goes out when it can't go out, back up. Or you'd get it in the arm, particularly for women who had radiation or mastectomy or breast cancer. Lymphedema would be something that can happen with that. Um, or people only threw the word around when the C word came up, cancer, right? Otherwise, it was just not on the radar at all. But then I started to look at, well, when you have trapped inflammation that's stuck inside of the body, your nervous system and your immune system are going to be on high alert all the time, which they're supposed to. But eventually that's going to burn out and you're going to fry your circuits. And then that causes disease slash disease. The biggest thing that I had was one, a couple. I had a lot of fatigue. I was just tired and lethargic all the time. Granted, I was working a lot, but it's still, I would get sleep, but I felt like, and no matter how much I slept, I never felt rested and just tired all the time. And the other one was brain fog. I started to really lose my brain. Like I just couldn't think well. It got so bad that I actually couldn't remember like something I just did like 10 seconds ago. Or sometimes I would be with like my kid's name, like, what's your name again? Right. And that scares you to death because that's like early onset Alzheimer's dementia. And it is because I've got trapped inflammation in my brain and I was headed that direction. Right. It was coming. That terrified me the most. So brain fog is a big one. I had a lot of sinus issues, congestion issues. You'll see this a lot. People who get sinus issues a lot, clearing the throat constantly, a lot of phlegm. And you start to get these crazy infections that come back a lot. Even candida infections are a huge one. Urinary tract infections that keep coming back no matter what. And guess who had every single symptom I'm mentioning to you? Another one is pain, pain that just doesn't resolve, particularly like a fibromyalgia type pain. Like everything hurts, systemic. Or you list, I feel like I got symptoms everywhere, like a ping pong ball bouncing all around in my body like a pinball machine. The first thing you want to think of is lymphatics, without a doubt. And a big one was I just had an appearance of puffiness and swelling in my face. I always look back and I'll go, geez, man, well, who put the pumpkin on my shoulders? It was like really big. And I work out. I've always worked
Yep.
out since I was 16 years
Yep.
old. I mean, I've been in a gym since I was in high school, and I've probably forgotten more about training and nutrition than most people know because I'm going to be 60. And I did all that stuff, and I was still like swelling and getting puffy. I couldn't lose weight, and I was very frustrated. And that's because when I look back in the long run, your body's not going to let you lose weight when you have so much inflammation inside of itself. It's going to try to protect itself because you have so much inflammation. And a protective strategy of the body is swelling and fat deposits. It's like a really effective technique when something else doesn't work. Like when your lymphatics get clogged, you're going to swell somewhere. And those are the biggest ones that stood out. And then I started to look at my patients, and then they had a lot of this stuff too.
Yeah.
Right? It's just like there's the
Yep.
moment, and it's like seeing them. I tell people once you see the Matrix, you can never go
Yeah.
back. I saw the Matrix. I said
Yeah.
I'm carrying this stuff around,
Yeah.
and here's I'm going to cycle it back to what I told you before. I started to work the lymphatic system with intention and in the right order because that's everything. Because I'm going to answer a common question that I get. And then within that 30-day time period, my brain fog really diminished. I started to have less pain. I'm like, you know what? Like, I'm not as tired today. And my memory started to spark because teaching at the time was a struggle for me at sometimes. But here's the kicker. I started to shed weight like a boss, man. Like I thinned out and trimmed out and lost, I'm not kidding you, 15 pounds in 30 days because it wasn't all body fat. It was swelling, puffiness, edema, inflammation that my body said, you know what? I don't have to hold on to this stuff anymore because Perry's smart enough to figure out that lymphatic stuff. And then he's getting it out, and I don't have to do it anymore. And then this is when I look back and saying, well, I still don't get it. Like in the beginning, what am I missing? Because I was doing movement. I was doing breathing. I'm doing fascia stuff. I'm doing light. But what I'm doing is I'm just arbitrarily trying to do it like anywhere I'm putting stuff or just to move. Well, that's not going to work when your lymphatic system is so stuck because you have to understand how the fluids move in the body based on this thing called pressure, and everything impacts pressure, including this thing called gravity. And if you don't release things in the right place, in the right order, stuff won't flow out. It'll flow, but it'll just bing, bang, boom, ricochet all over the place inside of you like that snow globe. And that's when I went, that's it. That's what I've been looking for. And here's the coolest part. I study a lot of stuff, and I started to study physics because I wanted to understand. I looked up the physics of fluid flow in the body, like biodynamics, and that's like biomedical engineering. And most people are going to be like, "Doc, seriously? I mean, why?" Because that's the only way you're going to understand how the fluids move. And then when I saw that, it made all the sense in the world because I'm coming at it from not just an anatomy
Yeah.
standpoint or even a clinical standpoint, but from a physics standpoint, like light.
Yes.
Like, by the physics of light, if I get it right, I'm going to get a response, whether you agree you're getting a response or not, because it's physics. It's the same thing with my work. I don't have to say, I hope this thing works. It works if you do it right.
Yeah. So this is amazing because I wanted to talk about this very specifically. If we're talking about just the health of your lymphatic system, I think now your approach to it is to prioritize the physical work on your lymphatic system, and then you really supplement a lot of that work with light. Is that a fair assessment of do the physical work, follow the systems that you've put together because you've put so much time into understanding, having an intentional approach to the physical work you're doing on the lymphatic system, and then light really becomes, well, it's easy. You don't have to do anything, so whether you're putting on the head wrap, which for me is my main approach to light every day, is I wear our head wrap, and then now I just lay on our mat. But that to me is very supportive to a lot of the other things that I'm doing to feel well, and I think that that's an important. I love the conversation. It's honest. It's like, no, if you have pain, you don't just put light on it and get better. You feel better because it helps on a physiological level, but there's a lot of work. It's a lot of work to take care of ourselves today in the modern world. When we were going to start this podcast, I told you I think I just need to move to a farm. And the reason being is that I joke about that, but at the core of it, you'd be outside all day, you'd be moving, you'd be lifting. And as crazy as it sounds, that's really all we need. That is movement. It's not just movement of muscles, it's movement of lymphatics. It's, taking the sedentary component of modern day living, which is really hard to combat, and it's abruptly, you know, taking it to the farm.
Yeah, I I couldn't agree more. Like 1000% uber duber on top of that. Yeah, but I'm all about basics and fundamentals because if you don't get the basics right, anything that's more complicated after that, you'll find doesn't really work well. Or if it does, it won't have a lasting result to it, right? And I love the things that you mentioned there in relationship to all those things, because here's the thing. Um, movement moves lymphatics. And then people say, what kind? And my answer is yes. Like, it doesn't matter. Like, try to just move more of yourself. That's a good thing. That's why walking is so awesome, because it's a unique thing that helps people feel better, right? And then jumping up and down on rebounders are great, or better yet, you have built-in rebounders called calf muscles that are designed to pump vein fluid and lymph fluid back up towards your heart. They're called the second heart in Eastern medicine. You don't really use that much if you're like sitting all the time, right? So the movement moves lymphatics, then breathing moves lymphatics. So honestly, everything that you do moves the lymphatics, but it kind of comes back to what I was saying before of like, well, then I should be good, right? I mean, why do I need to do anything special? Because they're just so backed up, so stagnated, so compromised that those are no longer enough to actually do it. And so you have to get in there. I always say, if you look in a dictionary and you see health, this should have a word next to it called work, because it takes work
It does.
to be
It
healthy,
does.
right? And you got to put your time in. You got to keep showing up. And you know, the more you put in, the more you're going to get out. And light is awesome. Like if you get in front of a panel, you're going to get the stimulation, and it's going to hit your cells, and it's going to stimulate lymphatics. But I'm going to contend, based on the kind of physics that I was talking about, if you opened up those routes by hand first to clear the pressure, and then you augment that, you add in the light,
100%.
well, it's even better, right? So it's what happens is that it's the sequencing of things that makes a really big difference in the results that you end up getting. Okay. And if you just switch those things around, that can be a huge deal. So here's an interesting thing. It's like, I love your full body mat, you know, and I love lying on that, particularly on the back, because light along the spine is so healing for your nervous system. It's not even funny. I could spend like a week talking about the importance of that. But then also your main lymphatic pipes are located in the front of the
Yep.
body. So that's where everything gets stagnated. So you need to take care of both sides, right?
Yeah.
And you can use light
I actually
a
lay
lot.
face down. So I don't spend the 30 minutes on it that, you probably should. I just kind of knock out 15 minutes, but I go 15 minutes head turned, one way, and I just do breathing, I do some like extensor work. I just kind of mess around a little bit, which I think is for a lot of people having the tools. So being able to have, we should do this, but having a routine that they could work their big six, like your lymphatic system, so they sit down on that mat and that's like, this is your session, work on it. Do some rebounding, do some breathing, work your big six, and then take your, 15 minutes and utilizing the light to really support everything you're doing.
I love that on the stomach stuff, because one, it does so much stuff from a neurological standpoint. Some people may have heard of the term tummy time.
Yeah.
You know, like babies and kids, they need tummy time. Why? Because it's a major part of your development for your nervous system to be able to pattern these complex movements later, like walking. But also, they're really powerful for the brain stem and the brain to spend time on your stomach, because you learn to get good head control there and using your eyes and everything like that. So if you can get on your belly there and then do some tummy time, that's going to be amazing for healing for you. But I found through my work is that, the front of the body is such a vulnerable space to human beings, because all of your major lymph is there, but also all of your vital organs are in the front, and so is all of your vital blood flow. So when you get into like a fight or flight, sympathetic dominant, I call it hypervigilance, hyperarousal, hang on for dear life so you don't die mode, which is the modern world that we're in. That feeds a protective strategy of curling into the front, flexion, and like the ultimate one would be curling into a tight fetal position ball. That is a protective / safety position. And the reason your body does that is because it knows that if I take out your carotid artery or your femoral artery or here, you're kind of dead. So you're reflexively flexing. And then that's the position that people are in when they sit and TikTok for 15 hours straight down. You feed this fight or flight response. And if you can make the anterior part of your body feel safer, you will downregulate the nervous system. You'll begin to inhibit pain everywhere. And that's the person who says, Doc, that's the craziest thing in the world. But I started to lie on that light, the pad, on my tummy. And then it's a great time to practice some of your breathing called crocodile breathing. Some people may know crocodile breathing. You can look up crocodile breathing. It's just teaching you to learn to breathe through your diaphragm muscle down low as opposed to your neck and your upper lungs and chest too much, which you probably are. You regulate that, and then the body just calms down, and then you get up and you say, wow, like my plantar fasciitis feels better. Like my elbow tendonitis feels better. And then you could actually put, this is where you could put your elbow wrap on the elbow or shoulder wrap, which I love that wrap. It's been so helpful for me. I have a shoulder injury on my right side. I've been nursing for a little bit here. But you can mix that in with relationship to the mat that you're lying on. And then the whole, because now you know, I'm not just going after my elbow. I'm going after the nervous system and the immune system and the human being attached to the elbow.
Yeah. I I was thinking of this the other day. I know you and I talk about a lot of stuff, but I am at the beginnings of going through menopause. You and I are in our wisdom years. And
Nice way to put that.
thank
Thank you.
you. Yep. I realize that there's so much messaging around menopause being a medical condition to be going through. So everything, all the symptoms, the brain fog, the lack of sleep, the anxiety, the frozen shoulders, the joint pain. And, you know, I don't buy it. I know you don't buy it either, because I think what it is it's like with anyone, if it's an autoimmune disease or a more serious disease, it's arriving at a point that understanding that by the time we experience something, the amount of time that things have been not working well is so hard for people to grasp how long it is.
Yeah.
It's really
Yeah.
long, you know? And so I got frozen shoulder in menopause, and I was like, you've got to be kidding me. How did I get frozen shoulder? I know everything about this. I know what you're supposed to do. And just textbook frozen shoulder. And it was so crazy to be like, look at the stagnation of my lymphatics. Look at the absolutely everything, the entire side that I had the frozen shoulder on. So yes, hormones could have played a role, but everything leading up to it, you know, was like just, oh man, like you said, most times that we have to learn something very important is through hardship and suffering. And so, yeah, I experienced it for 8 months and was just like, it was really sort of my way to sort of open the book on perimenopause and menopause and say to myself, what do you feel about this? You know, how do you
Yeah.
feel about this? And how are you going to approach this, what's supposed to be in many areas of the world celebrated, you know, transition of a woman's life to now being a, hey, this is a medical condition that you're
Right.
that you're experiencing. So anyway, it is a lot of work. All of it is a lot of work. So for people that are not feeling well, you know, I think to kind of conclude our conversation here today, of all the things you're being told you have to go do, you have to eat right. You have to exercise. You have to feed your mitochondria, you have to ground, you have to cold plunge, you have to
Yeah.
sauna, you have to take all these supplements, you have to filter your water. I mean, it's so much coming at us now that peeling back to understanding why we don't feel well and starting with the lymphatic system as a very fundamental system, I think is kind of the importance of your work now.
Yeah, absolutely. That's where I start first for one reason, because most people don't know about it and are not doing anything intentionally to help it. And it's the most important system that people really are missing, not paying attention to. Now, it doesn't mean that that's causing every one of your problems and everything is going to be unicorns and rainbows and the skies open up. But what I will tell you is that it's going to play a role in everything. You won't know how much until you start to clear it. Sometimes, like for me, it saved my life without question. But you'll find that if you clear this out, all of your other stuff that you're doing works better. That I'll guarantee you. But here's one of the things. I'm so glad you brought that up. We're in such a stressed modern world because of too much stimulation, too much information, and people are actually stressing themselves out more by trying to de-stress, by doing too many things to de-stress. And I'm like, I'd rather you not do 50 things because you're going to be in the quicksand. I can tell you that. And just do like 2 things consistently. And people have a hard time doing that because the world doesn't function like that anymore. And I have a phrase that I say all the time, and it's one of the biggest reasons why people reach a therapeutic failure and they don't get results. And it ties into light quite nicely because it's one of the things that helped me learn it. One of the things that you guys teach is that, more isn't better, better is better. And you can put too much light into something. And if you put too much light into something, you're like, why is this not helping? Because you did just too much of a good thing, man. You didn't need more than that. It's a sweet spot, minimum effective dose. That's physics. And it's the same thing in relationship to everything else that you're doing as well. An overwhelmed nervous system, an overwhelmed immune system is really easy to overwhelm. And you can overwhelm it with too many biohacks, too much light, too much supplements. So the first thing I do for people is get a list of everything that they're doing, and they usually will have to cut back because they're just putting a sledgehammer on a system where the body is going, listen, I get it. I really appreciate you trying to help me heal. I've been through a lot. That's great that you're helping me, but you're overloading my capacity to change here. And if you just take your foot off the gas a little bit, I'm going to jump to your side, trust me, and I'll help you heal because I've been trying to do that the whole time for you, you know?
Yeah.
So if people do that, they just do basics. Like I tell people, do my big 6, hydrate, jump up and down a little bit, take a walk with another person that you can actually talk to, and then do some red light. And you do that for 30 days. I guarantee you will physiologically feel a difference. And then just do it. And then people say, how often should I do this stuff? I'm like, the rest of your life.
Yep.
But just a little bit, little and often over the long haul. My friend Coach Dan John said that phrase, and that really stuck out for me. Consistency always beats intensity every single time.
Yep. The thing I love about the Big 6, because I think once you've learned it, you can follow it all over YouTube. Perry has courses on it. I mean, but it's so simple, Perry, and it's so easy to just be doing. It's so easy to say, "Oh, I'm in the shower. I'm going to brush my teeth, wash my hair, do my routine. Oh, I'm sitting at work on a Zoom call. I'm going to do." It's the absolute easiest thing to do, and I think people can really pay attention to how they feel, how they look, how their skin looks, how their circulation looks, areas where they were a little puffy here and there around their joints, in their collarbones, in their gut. It's really amazing the improvements that you can see. It's absolutely incredible. So as simple as you've made it, it's so accessible for everybody to feel better. So yeah, now
Thank you.
you're the
Thank you.
lymphatic ninja.
Yeah,
So,
I'll take that. Yep.
so okay, let's end this talk today. What is intriguing you these days? What are you reading about? What are you learning about? What's what might be popular 15 years from now?
Oh, that's a good one for sure. Well, one, it's always going to be lymphatics for sure. Um, I'll continue my love for physics without question. Because I think that you're going to find, honestly, within the next 15 years, a lot of things outside of the health and medical world making a difference on you feeling better in your health, but they're not necessarily in a category of health,
Yep.
kind of like physics, for instance. One of the things I read in a business book once is that if you're like, the example was a laundromat, is that if you want to have a successful laundromat, you need to study things outside of the laundromat. Like, you need to make yourself better at a lot of different things to help that. I think one of the things I'm going to probably get into, honestly, now is sleep. Like, a lot of people are talking about ways to biohack sleep to help yourself sleep. And I find that it's usually focused on do all these things 3 hours before you go to sleep. And then I'm like, well, what are you doing the rest of the time before you lay down for the 3 hours to go to sleep? Because I'm going to contend that's actually what you're missing. And the stuff that we talked about during the day. Because people say, Doc, I did your big six and then I did the light and I jumped up in line a little bit. And you know what? I actually slept better. Right. And I'm like, imagine that. Because that's how it works. All these different things that you work together to bring back. But I'll end this one. Here's my mission
Hmm.
to bring everything back in healthcare and when I teach to fundamental basics and foundational work that seems so simple that it's stupid. Like, if you tell me it can't be that, it's too simple, I know I'm absolutely 100% on the right track.
Yep. I could not agree more. And then uh, I just want to give you credit that when you put together a program that seems so simple for us, it has been a decade of you arriving at that. So many times the path to presenting the simplicity gets complicated. You know, right now I'm learning about magnetic fields. It's complicated. But I think when I arrive at what the message will be, it'll just be like, well, duh, this,
Right.
you know?
Yeah.
But I
If you
just
can do,
went and
yeah.
broke my brain trying to understand the magnetic fields of the earth, you know? And now I'm like, oh, yeah, this is why you need to be outside, by the way.
Oh, yeah. Well, that's a mark, honestly, of a great teacher and educator. You can make things seem just so simple. And I'm going to quote my friend Dan John one more time. He said, people don't realize how difficult it is to make something simple.
Yeah, it's a long process for sure. Well, today's talk was amazing. You are a dear friend and you have been very helpful for me as when we started Fringe and just giving feedback because I knew how much experience you had had using light. And so now every time we make something, I ship it to you, you know, or I ship you things
Yeah.
we're working on. And I just value having you as a friend and somebody who can give me, you know, really great feedback and we'll just keep go making cool stuff and a lot of it will be because Dr. Perry, you know, is playing around with weird things I'm working on.
I love it. We're the weirdos together, baby.
Yeah.
If somebody said, that was a quote by, I forgot her name, but she said, you're not crazy. You're just first.
Yes.
Which means that you bring stuff out that other people didn't think of, and then they think you're absolutely bananas. And then,
Yeah.
like 5 years later, like everybody's doing it.
Yeah.
So that's the crazy, and I love crazy,
Yeah.
so that's why we get along.
Yeah. And I mean, you are Fringe, right? In the truest essence of the name.
Big time.
You are
Yeah.
Fringe and it's such a positive thing. And so I think you and I probably our whole professional careers have been referred to as Fringe in a not so positive way, you know, by colleagues, by people who are supposed to like believe what we believe and know that the body really has a lot of power to heal itself, but here we are, kind of at the stage where now it's like, you know what, we're helping people, we're not hurting people, and we're willing to say we don't know stuff. We're willing to try new things. And
Well, that's the key right there. That's underlying the way it should be
yeah,
for everything.
yeah,
I don't know, but we're willing to give it a shot and see what happens. That's actually what's known as, everyone, the scientific method. Just,
yeah,
put it out there and see what happens.
yeah,
I don't know.
exactly.
But you got to be crazy enough to ask a different question.
Yeah,
That's what we do.
yeah, yeah. And then get to the point where you just don't care, and I know that you get a lot of people, throwing shade at you for so many years, and now you've arrived at the point where you just don't care, and
Yeah.
that's a really like, that's to me seems like there'll be even more magic coming from you over the next decade.
Thank you very much for that. Yeah, you're never going to change the world if you're worried about what other people think of you. Forget it. You're done. You're already checked out.
Yeah. So if you think Perry and I are weird, then you should hang out with us.
Yeah, you're
Hang out with
welcome.
us
You're
more.
in our tribe.
Yeah.
You're in our community. That's it. That's how we roll.
Yeah, exactly. All right. Thanks, Perry.
You bet.
See ya.
Thank you.